Hi, I'm going to be doing question 3, 5, 6, 7, and 9. So to start off with question 3, what is a sedation scale and what is the purpose of any scale? So a sedation scale is a validated, structured clinical tool used by a healthcare team to objectively quantify a patient's level of sedation, consciousness, or agitation. The purpose of any standardized scale is to replace subjective guesswork with clear criteria, standardized clinical communication across nursing and respiratory staff, guide the precise titration of sedative infusions, minimize the adverse effects of oversedation, such as delirium, prolonged mechanical ventilation, and undersedation with severe agitation and unplanned self-extubation. When we do this, that is tracks clear trends over time. Moving on to question 5, is the same medication used for everyone? No, medication choice is highly individualized based on the patient's specific underlying pathology and clinical phenotype, comorbidities, and acute therapeutic targets. And moving on to the next question, which goes a little more in depth to that question, or answers it a little better. Medications differ. The question is, why might medications differ from one patient to another? Medications differ due to variable patient factors such as cardiac tolerance. So we want to avoid tachycardic agents if someone has some cardiac issues. The type of inflammation present, so we don't want to trigger any eosinophils and give someone more inflammation than they need. Comorbidity conditions like COPD or kidney disease that can limit some of the drugs that are used, and whether the drug is needed for acute rescue versus long-term maintenance is also another key factor. Moving forward to the next question, which is, what is the usual goal of sedation / patient behavior? The goal is a patient who is calm, comfortable, and easily arousable, following simple commands and synchronous with the ventilator circuit, typically targeting a RASS score of -1 to 0. To our last question, what is ABCDEF bundle liberation? The bundle represents an evidence-based multi-professional ICU liberation framework designed to optimize patient care, minimize long-term cognitive / physical impairment, and reduce duration on mechanical ventilation. So A stands for assess, and within that it's assess, prevent, and manage pain. B is both spontaneous awakening trial and spontaneous breathing trial. C, choice of analgesics and sedation. D is delirium, and then continuing that, assessment, prevention, and management. E is early mobility and physical exercise, and F is family engagement and empowerment. If you guys have any further questions, feel free to leave a comment below.